Hello, ladies and gentlemen. Let's talk today about something that often gets overlooked when building omni-channel medical strategies. How do we actually measure success? This is one of the most common and important questions teams ask once an omni-channel strategy has been launched. Because while it's easy to get excited about channel mix, digital tools, and content orchestration, the true value of your plan is only realized if you can clearly demonstrate its impact. Now, the challenge in medical affairs is that success can't be measured the same way it is in commercial teams. We're not looking for increased prescriptions or conversions. We're looking to drive understanding, build trust, and influence the clinical conversation, ethically and strategically. So, in this session, we'll walk through the 8 critical categories of measurement that will help you assess whether your omni-channel plan is truly working, not just in activity, but in impact. First up, engagement metrics. This is where most teams start, and rightly so. You've launched your content, sent the emails, hosted the webinar. Now the question is, are healthcare professionals engaging with it? Here, you're looking at straightforward but essential digital indicators, open rates and click-through rates on emails, webinar attendance versus registration, video watch time or podcast downloads, channel usage across segments, even drop-off points, like where engagement declines or attention is lost. These numbers give you early signals. High engagement means the content is landing, and your timing and targeting are likely aligned. But low engagement? That may indicate misalignment between message, format, and stakeholder needs. However, don't stop at these surface numbers. Engagement alone isn't success, it's just the entry point to deeper, more meaningful evaluation. Second, reach and coverage metrics. Now let's go one level deeper. You're not just trying to reach more people. You're trying to reach the right people. So ask yourself, are you engaging the right specialties? Are you covering the intended geographies? Are your priority segments, like KOLs or digital-first HCPs, actually being reached? This is where segmentation data, CRM insights, and even attendance reports can be powerful. You want to track who's showing up, who's not, and whether that reflects your medical strategy. Because success is not just about exposure, it's about strategic alignment. If you plan to target cardiologists in the Gulf region and your participants were mostly general practitioners in Europe, that's a gap worth investigating. The reach and coverage metrics are particularly important in medical affairs, because unless you're consistently engaging the right key opinion leaders, the right regional experts, or those scientifically influential voices, then honestly, even the most sophisticated omnichannel plan could fall short. It's not about casting a wide net. It's about being precise and purposeful. So here's the reality. If your omnichannel effort is reaching the wrong segment, or even just failing to reach your top-tier targets with enough frequency, then the time, money, and resources you're spending may be better used elsewhere. That's why you must constantly evaluate who you're engaging, how often you're reaching them, whether they fall into your priority segments. Because in medical affairs, relevance is everything. Without it, you don't have impact, you just have activity. The third set of metrics measure the quality of engagement. Now we're getting to what really matters. Not just how many people you engaged, but how well you engaged them. This is where omnichannel shines, or fails. A truly successful plan doesn't just generate interactions. It delivers meaningful experiences. You're looking to answer questions like, how long did HCPs stay on a webinar? Did they ask questions or request follow-ups? Are MSLs reporting deeper conversations as a result of the omnichannel journey? Qualitative feedback becomes key here. Did the content feel relevant? Did it prompt clinical reflection? Are they re-engaging with future touchpoints? If you're seeing short, shallow engagement, clicks with no follow-up or conversations that go nowhere, then you're likely executing a multi-channel plan, not a true omni-channel one. Number 4 is those metrics we can use to measure the insight generation. One of the biggest advantages of an omni-channel strategy is that every touch point is an opportunity to listen. Yet many medical affairs teams focus only on what they're delivering and not what they're hearing. So ask yourself, are you collecting insights systematically? Are those insights being analyzed, categorized, and, most importantly, used? What percentage of insights are leading to content adjustments, strategy shifts, or new data requests? A successful omni-channel plan doesn't just deliver scientific information. It captures real-world understanding from the field and feeds it back into your strategy in real time. That feedback loop is a goldmine, but only if you're measuring it. The 5th is scientific impact. Here's where medical affairs distinguishes itself from commercial. We're not just trying to engage, we're trying to educate, shape understanding, and close clinical knowledge gaps. But how do you measure that? One way is through knowledge assessments, pre- and post-engagement surveys, polling during webinars, or MSL feedback on HCP confidence levels. Another way is to look at message retention. Are HCPs referencing your content weeks or months later? Are they requesting further detail? Are they sharing the material with colleagues? And don't underestimate anecdotal evidence. Sometimes the most powerful proof of scientific impact is hearing an HCP say, "That data helped me rethink how I manage my patients." 6th, the channel effectiveness. Now let's look at performance, not just of the plan overall, but of each individual channel. Are some channels consistently outperforming others? Is one format under-delivering despite heavy investment? This is where you evaluate engagement to cost ratio, transition rates from email to registration or digital to field visit, preference trends among stakeholder segments. For example, if KOLs in one region consistently prefer in-person advisory boards over digital webinars, adjust accordingly. Omnichannel is about orchestration, not volume. More channels isn't better. The right channels at the right time for the right audience, that's what drives success. And number 7, compliance and governance. This part is non-negotiable. In the pursuit of engagement, we cannot compromise integrity. So as you execute your omnichannel plan, track how well you're adhering to internal approval processes, local and global compliance standards, SOPs for digital and field content. You'll want to monitor things like medical, legal, regulatory, MLR, approval timelines, number of deviations or exceptions logged, documentation rates across all touch points, because a plan that's highly engaging but poorly governed is a risk, not a success. Number 8, and finally, long-term strategic value. At the end of the day, success isn't measured in clicks. It's measured in contribution. Did your omnichannel plan support the larger medical strategy? Did it generate insights that shaped internal priorities? Did it strengthen your organization's position as a trusted scientific partner? You can measure this by tracking alignment with strategic objectives, HCP trust indicators, repeat engagement, unsolicited feedback, etc. Cross-functional impact, especially with market access or R&D contribution to thought leadership within your therapeutic area. This is where you connect the dots between what you planned, what you executed, and what you actually achieved. And it's what separates tactical execution from true medical leadership. To wrap up this section, the most important is to start with measurement in mind. Too often, metrics are treated as an afterthought. But the most successful teams define their KPIs before the first email is sent or the first event goes live. Because when you know how you're going to measure success, you'll build a smarter, sharper, more strategic omnichannel plan, one that doesn't just engage, but truly transforms the way medical affairs delivers value. Thank you. In our next session, we will discuss the role of data analytics in measuring the omnichannel metrics. So see you soon.